What if your heart is sending you signals you can't ignore? Right now, as you watch this, your heart is working tirelessly, pumping blood to every corner of your body, delivering oxygen and nutrients that keep you alive. But what happens when this remarkable organ starts to struggle? What happens when it begins whispering messages through symptoms we often dismiss as just getting older or being out of shape? Heart failure doesn't announce itself with fanfare. It creeps in quietly, leaving breadcrumbs of warning signs that many people walk right past without noticing. Today, we're going to decode those signals together, understand what they mean, and most importantly, learn what you can do about them. The story often begins with fatigue, but not the kind you feel after a long day or a poor night's sleep. This is different. This is the exhaustion that settles into your bones and refuses to leave no matter how much you rest. You might notice it first when climbing stairs that never used to bother you suddenly leaves you breathless and spent. That morning routine that used to be automatic now feels like you're moving through water. You sit down more often. You cancel plans because you just don't have the energy. This happens because when your heart weakens, it can't pump blood efficiently enough to meet your body's demands. Your muscles and organs aren't getting the oxygen-rich blood they need to function optimally, so everything requires more effort. Your body is essentially running on a reduced power supply, and you feel it in every movement, every task, every moment of your day. Then comes the fluid buildup, and this is where things become more visible. You might notice your shoes feeling tighter by the end of the day, or rings that suddenly won't slide off your fingers. Your ankles and feet begin to swell, sometimes dramatically. Press your finger into the swollen area and you might see an indentation that stays there for a few seconds, like pressing into soft dough. This is called pitting edema. It happens because when your heart isn't pumping effectively, blood flow slows down and fluid from your blood vessels leaks into surrounding tissues. Gravity pulls this fluid downward, which is why it typically shows up in your legs and feet first. But fluid doesn't only accumulate in your extremities. It can build up in your abdomen, creating a sensation of fullness and bloating that makes eating uncomfortable. You might notice your waistband getting tighter even though you haven't gained fat. Some people develop fluid retention so significant that they gain several pounds in just a few days, and that weight isn't coming from overeating, it's coming from water your body can't properly eliminate. The cough that won't quit is another verse in this unfolding story. At first, you might attribute it to allergies or a lingering cold. But this cough persists, especially when you're lying down at night. You might find yourself propping up on extra pillows just to breathe comfortably, or waking up gasping for air in the middle of the night. Sometimes the cough produces white or pink-tinged phlegm that looks foamy. This happens because fluid is backing up into your lungs, a condition called pulmonary edema. When your heart's left side weakens and can't pump blood forward efficiently, pressure builds backward into the blood vessels of your lungs. Fluid seeps from these vessels into the tiny air sacs where oxygen exchange normally happens, making breathing difficult and triggering that persistent, nagging cough. You might also experience wheezing or a feeling of suffocating, especially during physical activity or when lying flat. Rapid or irregular heartbeat often joins this constellation of symptoms. Your heart, sensing that it's not pumping effectively, tries to compensate by beating faster. You might feel your heart racing even when you're sitting still, or experience palpitations where you're suddenly acutely aware of your heartbeat, feeling it pounding or fluttering in your chest. Sometimes the rhythm becomes chaotic and irregular, a condition called atrial fibrillation that's common in heart failure. This irregular beating isn't just uncomfortable, it's inefficient, further reducing your heart's ability to pump blood effectively and increasing the risk of blood clots forming in the heart chambers. Decreased appetite and nausea might seem unrelated to your heart, but they're part of this same story. When fluid builds up in your liver and digestive system due to poor circulation, you lose your desire to eat. Food might seem unappealing or make you feel sick. You might feel full after just a few bites. Over time, this can lead to unintended weight loss and nutritional deficiencies that further weaken your body's ability to cope with the demands placed on it. Mental fog and confusion can develop as heart failure progresses. When your brain isn't receiving adequate blood flow and oxygen, cognitive functions suffer.
Is under stress. Elevated levels suggest heart failure. Other blood work checks your kidney function, liver enzymes, thyroid levels, and blood count, all of which help paint a complete picture of what's happening in your body. An electrocardiogram records your heart's electrical activity, revealing rhythm abnormalities, signs of previous heart attacks, or enlargement of heart chambers. This simple test takes just minutes, but provides invaluable information about how your heart is functioning electrically. The chest X-ray shows the size and shape of your heart and whether fluid has accumulated in your lungs. An enlarged heart is a common finding in heart failure, and the X-ray can reveal the characteristic pattern of pulmonary congestion. But the gold standard test is the echocardiogram, an ultrasound of your heart. This remarkable technology lets doctors see your heart beating in real time, measure the thickness of heart walls, observe valve function, and calculate ejection fraction, the percentage of blood your heart pumps out with each beat. A normal ejection fraction is between 55 and 70%. In heart failure, this number drops, sometimes dramatically. The echocardiogram distinguishes between different types of heart failure, whether your heart muscle is weak and dilated or stiff and unable to relax properly, and this distinction guides treatment decisions. Sometimes additional testing is needed. A stress test evaluates how your heart performs under physical exertion. Cardiac catheterization might be performed to look directly at your coronary arteries and measure pressures inside your heart chambers. Cardiac MRI provides detailed images of heart structure and function. Each test adds another piece to the diagnostic puzzle. Now comes the hopeful bridge, because here's what matters most. Heart failure is manageable. While the term sounds final and frightening, it doesn't mean your heart has stopped or is about to stop. It means your heart needs support, and there are many ways to provide that support. Medications form the cornerstone of treatment. ACE inhibitors or ARBs relax blood vessels and reduce the workload on your heart. Beta blockers slow your heart rate and lower blood pressure, giving your heart a chance to pump more effectively. Diuretics, often called water pills, help your body eliminate excess fluid, reducing swelling and easing breathing. Aldosterone antagonists provide additional fluid removal and protect your heart from further damage. Newer medications like SGLT2 inhibitors and ARNI combinations have revolutionized heart failure treatment, improving both quality of life and survival rates. Lifestyle modifications amplify the benefits of medication. Reducing sodium intake is crucial because salt causes fluid retention. This means reading labels carefully, avoiding processed foods, and cooking fresh meals where you control the salt. Monitoring your weight daily helps catch fluid retention early. A sudden gain of 2 to 3 pounds in a day or 5 pounds in a week signals that fluid is accumulating and your treatment plan may need adjustment. Staying physically active, even with heart failure, is important. Start slowly with your doctor's guidance. Regular movement strengthens your heart and improves your overall conditioning. Limiting fluid intake might seem counterintuitive, but drinking too much can overwhelm your heart's already reduced pumping capacity. Managing other conditions becomes essential. Control your blood pressure, manage diabetes carefully, and treat sleep apnea if you have it. Stop smoking completely. Limit alcohol or eliminate it entirely. Get vaccinated against flu and pneumonia to avoid infections that stress your heart. Some people benefit from cardiac devices. A pacemaker can regulate heart rhythm. An implantable cardioverter defibrillator prevents sudden cardiac death from dangerous arrhythmias. Cardiac resynchronization therapy helps the heart's chambers beat in better coordination. In severe cases, a ventricular assist device or heart transplant might be considered, but most people manage well with medications and lifestyle changes. Pacing yourself becomes an art form. Learn to recognize your limits and respect them. Break tasks into smaller chunks. Rest between activities. Ask for help when you need it. This isn't giving up, it's being smart about energy management. Schedule important activities for times when you typically feel best. Create an environment that minimizes physical demands. Keep frequently used items within easy reach. Consider a shower chair if bathing exhausts you. Build a support system. Share your diagnosis with family and friends. Join a support group where you can connect with others navigating similar challenges. Work closely with your healthcare team, attending all appointments, reporting new or worsening symptoms promptly, and taking medications exactly as prescribed. Keep a symptom journal noting what you experience each day, what activities you managed, and how you felt. This information helps your doctor fine-tune your treatment. Your heart story is still being written. Yes, heart failure is serious, but it's not the end of your narrative. With proper treatment, lifestyle adjustments, and attentive self-care, many people with heart failure live full, meaningful lives for years or even decades after diagnosis. Listen closely to what your heart is telling you. Those signals, fatigue, swelling, breathlessness, irregular rhythms, they're not meant to frighten you. They're your body's way of asking for help, for attention, for care. Answer that call. Seek medical evaluation if you're experiencing these symptoms. Follow through with testing and treatment. Embrace the changes that support your heart's health. Your heart has been beating faithfully since before you were born, every moment of every day. Now it needs you to return the favor by paying attention, taking action, and giving it the support it needs to keep your story going. Subscribe, like, and share for more.